Hello, my name is Hayden Potter, and today I'll be demonstrating how to perform a basic IV insertion. The first thing that we will do is implement our standard protocol. We'll check our MAR and we'll assess for the type and duration of IV drug therapy. We'll assess lab data and allergies, and we'll determine the appropriate size catheter based upon if the client will need any surgical procedures or blood transfusion. We'll next prepare our equipment. I have a syringe of 3 milliliters of prepared saline, and I have my tubing. We'll prime the INT with 3 milliliters of normal saline, and we'll leave the syringe attached, and we'll clamp the INT and prepare for our IV insertion. So I'm going to open my tubing, bag of tubing. I'm going to attach and clamp. So we're good to go on that. And the next thing that we're going to do is we're going to just look and select a vein based on whether or not it's dominant or non-dominant. We want non-dominant hand in this case, and we're going to choose the most distal site. We'll avoid any areas that are tender or red and painful to palpation, and we'll avoid a side that has had any history of mastectomies, fistula, or renal dialysis, and we'll also avoid a site that's going to interfere with the patient's activities of daily living. Now we will begin by applying our tourniquet, and I'm going to perform hand hygiene and put our gloves on. And the next thing that we're going to do is we've applied our tourniquet 4 to 6 inches above our intended IV insertion site, and we're going to feel for a radial pulse. I feel a radial pulse, and I am applied the gloves. I'm going to cleanse my site, and I've chosen the most straight vein right here, and I have a 20 gauge needle, and I'm allowing that to air dry. And I'm also going to warn my patient that he's going to have a sharp stick when I insert my 20 gauge needle. So, Mr. Jackson, I'm preparing. I'm going to stabilize my vein. We're going in at a 15-degree angle. Big stick, Mr. Jackson. I see a flashback. I'm going to pull my catheter up. And I've inserted the catheter at a 15-degree angle. I've observed for a flashback. I'm holding this vein. I'm releasing my tourniquet, and I'm applying pressure 1 inch above the site. And I'm going to I've removed the stylet, and I'm going to connect my INT now. Almost done, Mr. Jackson. Okay, and I am going to verify placement by aspirating. Okay, I'm going to aspirate now, pulling back a little bit. I see a blood return, and I'm going to unclamp my INT now, and I'm going to insert my 3 milliliters of normal saline using the push-pause method. Push, pause until we reach 3 milliliters. So we verified placement. We've inserted with 3 milliliters of normal saline, and I am going to now clamp my INT, use positive pressure, and clamp my INT now so that there's no air bubbles or anything. I'm going to undo my normal saline syringe, and I'm going to apply a sterile dressing over Mr. Jackson's IV site so it doesn't get ripped out by accident. Okay, so we've applied our sterile dressing. I'm now going to tape this in a U shape so as not to interfere. I'm going to label my dressing with the date, time, and the gauge of the needle that was used in my initials. And I'm going to tape and secure my tubing now in a U shape. Okay, I'm going to dispose of any uncapped needles and any stylets into the sharps container. I'm going to remove my gloves and perform hand hygiene, and I'm going to document the time and date of the insertion site, the arm, the number of attempts, the size of and type of the catheter, the client response. In this case, Mr. Jackson tolerated the IV insertion well, and any instructions given, and I'm going to advise if any redness, swelling, or pain occurs to please notify me, and I'm going to also keep a close eye on that. And that concludes performing basic IV insertion. Thank you.